Hi, I'm Dr. Alan Morrison, and I've collaborated with Castle Connolly Private Health Partners to create Morrison Membership Practice. Well, my path to opening my own office here in DC started after my first job, which was in South Florida. I started in internal medicine at Nova Southeastern University. That was my first job following my training. And after that, my wife and I decided to move back here to the DC area and practice. Well, the thing I like most about practicing in a solo internal medicine practice like mine is really getting to know people. We have a great location here in upper northwest DC. We've got great folks from the neighborhood. We have people from downtown, Virginia, all around DC and Maryland. And they're great people. Having the time to meet with them and talk with them and get to know them and be part of their lives is just one of the most important parts of being in medicine to me. I've been thinking about moving to a membership model or concierge model for a little while. The way medicine has gone, as far as high volume, seeing more and more people every day, spending less and less time with them, just didn't feel right. The story is not as simple as the first few minutes. The story is always changing. The history needs to be delved into. There is depth to people and their lives and their stories. And without having the time to dive in, we'll never really get to the core of the issue. And I think with time, I'll be able to do that, and we'll be able to do that together. I chose to partner with Castle Connolly Private Health Partners because the model made sense. The timing made sense. The value added from the services that Castle Connolly brings to the table as far as connectivity, health coaching, video visits, all of the technology behind those things are all part of the partnership, and the health coaching is one of the most innovative and exciting parts of the program. I think my patients are going to benefit from the 24-hour connectivity to me with my personal cell, the texting ability. I think there's going to be a comfort level that they have that they've never had before that they can get me directly. The same and next day appointments are a must. We've built them into our schedule currently, and we'll continue to do that as we move into the membership. People need to be seen when they want to be seen, when they have to be seen. Having that direct cell phone number, having that ability to text, having that ability to connect, whether it's a video visit or sending a photo of a rash, all in a HIPAA-compliant manner, is crucial. People have asked me about the connectivity to Castle Connolly's top doctors. The good news is we have access to people around the country if we need them. And in the meantime, they can keep their specialists who they have here in DC or other places where they may travel, and will continue to refer to doctors who I know and trust here in the DC area. So when you walk into one of our exam rooms, each room has its own antique medical bag. And when you see that antique medical bag, it reminds me, and I think it reminds patients, because they tell me almost every day, how it reminds them of a different time of medicine, when doctors treated them differently, when they had a family doctor that cared about them. It brings back wonderful memories for them. When people leave after a visit, I want them to feel heard. I want them to feel that they're important, that they've been given the time that they need to have their issues heard and handled appropriately in a timely manner, that they weren't rushed through their appointment, that their time was well spent with someone who they trust and who they'll come back to for their issues in the future.